Nearly 3,000 cases, 1,300 dead, and the people paid to contain it just walked off the job. For anyone joining us in the middle of this, here's the short version. In DRC's Bundibugyo Ebola outbreak, the response comes down to finding exposed contacts fast enough to break transmission. Insecurity and field access limits in eastern DRC have left health teams with an incomplete picture, and there's still no authorized vaccine or specific antiviral for this Ebola species, so the medical toolkit is thin.
This is Ebola Watch. Today, a Prime Minister demanding speed, a workforce on strike over pay, and a vaccine that has only just reached its first human trial. Where does that leave the response? We're staying on DRC Bundibugyo Ebola outbreak. Follow the show, and you won't miss what comes next.
Xinhua writes,
Confirmed Ebola cases in the Democratic Republic of the Congo, DRC, have risen to 2,973, including 1,309 deaths, as Prime Minister Judith Suminwa Tuluka warned on Friday that the outbreak could further aggravate the humanitarian crisis in the eastern DRC.
Here's a DRC Bundibugyo update. Confirmed cases are now at 2,973, with 1,309 deaths. And notice who was speaking Friday from Bunia. Prime Minister Judith Suminwa Tuluka, the head of government, not a health ministry spokesperson. When the Prime Minister herself stands in the epicenter and calls for a faster response, the health emergency has become a governance problem too.
She says $50 million has been dispersed, plus whatever partners have mobilized. So, Kara, what does a faster response actually buy? She's listing ambulances, oxygen, lab kits, burial equipment. We're hearing a shopping list. I want the strategy.
And that's the honest part of her statement. She said the issue now is logistics. Committing money in Kinshasa doesn't deliver oxygen to Ituri. The dollars and the doses still have to physically arrive.
1,309 dead out of 2,973 confirmed. That's a fatality rate near 44%, with just 540 recoveries. Nearly 3,000 cases in, and the government is still figuring out how to get water and ambulances where they're needed.
From Prosper Harry Ngorora, Constant Same Bagalwa at News Gazette.
Health workers at an Ebola treatment center in eastern Congo went on strike on Saturday, demanding their pay. The walkout disrupted care for patients in the epicenter of the country's rapidly growing outbreak. The number of confirmed cases of Ebola in Congo has reached 2,973, including 1,309 deaths, according to government data released on Friday in what authorities say is the fastest-growing outbreak on record.
So those numbers we just heard from the PM, 2,973 cases, 1,309 dead. The people whose job is to stop them from climbing walked off in Bunia on Saturday. Doctors, nurses, security staff. The whole Elikia treatment center just stopped.
And let's be precise about why. Unpaid bonuses and back pay. Not fear, not security. About 100 workers stood outside the center in Ituri, saying they need to be paid so they can go back in.
That's the clearest explanation we've had all week for why contact tracing keeps failing. Turns out the transmission chain stays open when the person tracing it hasn't been paid.
One of the workers, Martin Bolumbi, put it plainly. The disease is spreading inside the treatment center while they wait. So when the Prime Minister calls for a faster response, this is what she's up against. A workforce that's already walked out over wages, right in the middle of the fastest-growing outbreak on record.
There were funding pledges flying around this week. I'd love to know where a single dollar of it is showing up, because it clearly isn't in these paychecks. We have 2 approved Ebola vaccines sitting on shelves, and yet responders in DRC and Uganda basically can't use either one right now. What's going on?
Right. There's an important distinction here that's easy to miss. Ebola is actually a family of viruses, formerly called ortho-Ebola viruses. The 2 approved vaccines, Ervebo and the Zabdano-Mavabea regimen, were designed specifically to target Ebola virus, the species responsible for the large West Africa outbreak a decade ago. Bundibugyo virus is a different species in the same family. It causes very similar disease, but it's different enough that those vaccines don't provide reliable cross-protection, per the analysis in NPJ viruses. The WHO declared this outbreak a public health emergency of international concern, a PHEIC, and convened a technical advisory group in late May to review which countermeasures might work against Bundibugyo virus. That group's report says there are no licensed vaccines or treatments for this species. Lab confirmation came on May 15th, per the WHO Disease Outbreak News, when the INRB in Kinshasa identified Bundibugyo virus in 8 of 13 blood samples from Ituri province. So the clock on finding usable tools only started ticking weeks ago. On the treatment side, researchers affiliated with the Uganda Ministry of Health and Dalhousie University have published preliminary computational work suggesting remdesivir triphosphate may inhibit the Bundibugyo virus polymerase. That work has 0 citations so far, so treat it as very early and preliminary. And per Gavi, the first vaccine candidate tailored to Bundibugyo virus has only just entered Phase 1 human trials. It won't be available to field responders during the acute phase of this outbreak.
So if the licensed vaccines are off the table and the new one is still in trials, what does response actually look like on the ground right now?
For now, the response falls back on the classic outbreak control toolkit. Identify cases fast, isolate them, trace contacts across the DRC-Uganda border, and provide supportive clinical care. The NEJM piece by Sullivan underscores that those are the core of Bundibugyo disease management when there are no specific licensed countermeasures. The WHO advisory group is also evaluating monoclonal antibody candidates and antivirals for potential compassionate or trial use, so the options could shift. Updates from WHO's FEAC committee and the DRC and Uganda health ministries, especially on cross-border contact tracing capacity, will give us the earliest signals of whether containment is holding.
For more outbreak coverage, try Hantavirus Watch. It has daily updates on the 2026 outbreak from the MV Hondius Andes virus cluster and the CDC and WHO response to contact tracing and traveler risk. Find it wherever you listen to podcasts. In the coming days, we'll be watching to see whether the Bunia payment backlog is cleared through mobile money payments, as the response operations manager said. You'll find links to every story in today's show notes if you want to read more. That's Ebola Watch for today. This is a Lantern podcast.